nag-aalab ang puso. Sino pa naman ang masayang ang minamahal ay iwan upang ang buhay sugal at makipagsapalaran. Mabuhay ka, migranteng Pilipino, walang hindi magagawa, hangad ay pagunlad ng bansa. Mabuhay ka, migranteng Pilipino, walang hindi magagawa kung makakaisa ang migranteng Pilipino. Saan mang dako ng mundo, lahat ng api at tinapuso, nag-aalab ang puso.
Magandang gabi po. You're listening to Radyo Migrante on CHRY 105.5 FM. My name's Alex. I'm your host for today. Everyone is taking a break this week, so it'll just be you and me. And we're going to be talking about TB today, a serious topic, a serious health issue that affects a lot of Filipinos here in Canada and in the Philippines, and one that unfortunately a lot of people, and I have to include myself in this, don't know much about the topic. Our guest later in the program will be Genevieve Canizares. She is a public health nurse currently working in the tuberculosis prevention and control program at the Toronto Public Health. And she has also been working in the TB program for about 6 years now and is currently with the prevention team conducting outreach and education in the community. So let's begin with a little bit of news and then let's talk a little bit about what's going on here at York. So to start off with, the first bit of news we'll talk about is the worsening health and hunger that hound the Lumad internal refugees in Agusan del Sur in the Philippines. 969 Banawan Lumads fled their community due to reported human rights violations and sought refuge in an abandoned hospital in Balit Village, San Luis, which serves as an evacuation center. 3 children, 4 years of age and younger, have already died at the center. Recurring coughs, colds, measles, amoebiasis are illnesses that the Banawans have acquired while staying at the center. Many of the children and infants are undernourished, and nursing mothers have been lactating less due to the lack of food. Nutritious food is also scarce at the center, making the children more susceptible to illness. And Ermelita Lor, a community health worker from the Community Health-Based Services, CHBS, Northern Mindanao region, says that the lack of food and proper nutrition causes recurring illnesses in the refugees. For Lor, who arrived at the evacuation center on January 26, she found that all the residents of the 14 sitios in San Luis who had left their homes 3 days earlier. Even earlier, however, since December of last year, residents in one sitio had been evacuated to other villages because of human rights violations committed by members of the 26th Infantry Battalion Philippine Army Unit. From March 9 to March 10 this year, the Balit Mission, an international solidarity mission, looked into the reported human rights violations and the forcible evacuation of the Lumads. A medical and dental mission were also held. The mission was jointly organized by the Northern Mindanao and Caraga formations of Karapatan, Northern Missionaries of the Philippines, Kumalaran, Kalumbay, Kasolo, and the Asia Indigenous Peoples Network, and the extractive industries and energy. The mission found that when the residents of the 14 sitios fled their houses, some of them were reportedly already ill, mostly children. Karapatan had documented the deaths, as I said, of already 4. These 4 are 4-year-old Jamson, who already had the German measles when they evacuated. Due to exhaustion and lack of food, Jamson died on January 6 in a temporary evacuation site. 3-year-old Miguel was also already suffering from German measles. Since January 4, according to his father, he died on January 8 due to exhaustion and lack of sanitation. On February 2nd, 18-year-old Nayan Galiano died of ectopic pregnancy at the evacuation site after being discharged from a hospital. And on February 12, Printon Sayasaya, 2 years old, died at an evacuation center due to severe pneumonia. Health workers have also noted several cases of tuberculosis amongst the evacuees. The patients were needing laboratory procedures like X-ray and sputum tests. Many of the adult patients are suspected to have tuberculosis, but patients chose not to pursue the test due to a lack of money. They also worried about paying for their medicine because they no longer had any source of income. Requirements in hospitals such as certificate of indigency and birth certificates hindered the Lumads from getting the direly needed medical attention. Diarrhea is also a major problem. Laura said 65% of the refugees had diarrhea due to a lack of potable water. The refugees would rather make do without water just to avoid passing through the camp of soldiers on the way to the water source. Diarrhea was also due to the lack of toilets and sanitation facilities. Laura said that the evacuees dug up common latrines, but these were barely enough for the large number of people. Children often went hungry and suffered from a lack of food, and what food they did have was of poor nutritious quality, which compounded their illnesses. Laura said that the usual food in the evacuation center was dried fish, smoked fish, canned goods, and noodles. At one point, they had to prioritize feeding 30 children, mostly babies, because the mothers could no longer lactate. Laura said that the evacuees survived every day with the help of non-government organizations and the rural missionaries of the Philippines. Some members of the CBHS are still at the evacuation center to monitor the health conditions of the evacuees. The CBHS were also able to train health workers on how to get the vital signs and about the principles of basic health and herbal medicine in order to help the evacuees. Laura said the displacement had caused great impact on the Lumads, because it removes them from what they were accustomed to and ruins their everyday routine. The Banawan Lumads hope that they will soon be able to return to their home communities, live normal lives, and with their children go back to school and eat nutritious food. The second news for today, a paralyzed temporary foreign worker is ordered to leave the country, Canada, and she asked for compassion. A disabled temporary foreign worker from the Philippines has been ordered to leave Canada, but is asking that she be allowed to stay on humanitarian grounds. Maria Vicky Vernasio was paralyzed on June 2011 when she was riding her bike to work and was hit by a car. She's been issued an exclusion order, which means she must leave the country at least a year. A decision about her removal is about to be determined at a future hearing before the Canadian Border Services Agency. Her lawyer says that she has filed an application to stay in Canada as a permanent resident. He says that she can get some kind of health. She wouldn't be able to get this the type of medical treatment that she needs in the Philippines, and that she is working with her doctors and the university in Alberta and is actually making tremendous progress in her mobility. She's been able to stand up on her own, which was almost unimaginable when her accident happened a few years ago. She said that she was originally told by a doctor that she would never walk again, but right now she's been able to move around on her own and is starting to become more independent, even while in her wheelchair. She was an employee at McDonald's. Her contract entitled her to some medical benefits, which she said she did not receive. Her lawyer said that she will be seeking compensation from the franchise. It is uncertain whether she'll be allowed to stay in Canada or if she'll be forced to return to the Philippines. There's an online petition set up calling to the government of Canada to allow her to stay and be able to live and work here in Canada as a permanent resident. In light of the upcoming policy changes or the already put through policy changes on Canada's temporary foreign worker program, about 45,000 temporary foreign workers who are Filipinos are set to be sent home starting this coming April 1st. The temporary foreign workers are admitted to Canada for time-limited periods, which include highly skilled, specialized workers employed on short-term work contracts, while others are lower-skilled workers who fill temporary and seasonal positions. And last on the news, I wanted to talk a bit about what's happening here at York University. As you know, this has been about this coming week will be the fourth week of the strike of Union Local Number 3903. And I think it's interesting to connect what's happening here at York University with the changing educational landscape around the world. We've been able to see in the Philippines through Radyo Migrante and through the news coming out of the Philippines, the changes that are happening within the educational structure. For example, the K-12 program, which are adding more high school years, the rising cost of tuition in the Philippines. And all of this, of course, is to help make Filipinos more attractive in terms of migrant workers around the world. And this, of course, links to the issue of precarious work that we can see happening worldwide, and as we can see here in the strike at York University and at the University of Toronto. And so this coming week 4 of the strike here, we at Radio Migrante want to give our support to both of the unions at York University and here at York University and at the University of Toronto. We're about to talk with Genevieve Canizares. She's a public health nurse currently working in the tuberculosis prevention and control program at Toronto Public Health. She's been in this program for about 6 years now and is currently working with the prevention team, conducting outreach and education within the community. She was a master's student of nursing at Ryerson University, and her professional interests include global and public health, nursing research, career planning and development for nurses, tuberculosis, and sexual health. She's been giving health information sessions to migrante and Bayan organizations in Toronto, including with Gabriela, Ontario. So good evening. Are you there, Genevieve?
Hi there. Good evening.
Hi,
yes,
how are you?
I'm here. I'm good. How are you doing?
Doing all right. Enjoying your weekend, I hope?
Yeah, it's been busy, but good so far.
All right. Well, let's get right into the swing of it. I think let's start with the basics, because as I was telling you earlier, this is something that'll be is something I should probably be ashamed of not knowing much about. But I don't know really what is TB? Like, what are its health effects? What are its symptoms? How do we know if we have it?
Sure. Well, if it's any consolation, a lot of people, or TB is not something that's commonly known among the general public, so don't feel so bad. But TB is a bacteria that generally affects the lungs. However, it can affect any part of the body. And some of the common signs and symptoms of TB includes a fever, a cough that's a minimum of 3 weeks or longer, feeling tired, having loss of appetite, weight loss, night sweats. And so those are some of the common signs and symptoms. But there are 2 types of TB, which most people aren't aware about. And I think if there's one thing I want listeners to take away tonight, it's the difference between TB infection and TB disease. Have you heard anything about the difference between TB infection and TB disease?
Unfortunately, no. I'm sorry.
Okay.
But yeah, this will be great. I'll be getting an education tonight too.
Okay. So TB infection means that at some point an individual has been exposed to the bacteria. However, they're not able to spread it to other people. So they would have a normal chest x-ray. They wouldn't have any signs and symptoms of TB, but they would have a positive TB skin test. Now, TB disease means that someone's been exposed to the bacteria as well. However, it's what I like to, or how I describe it is that it's awake in their body and it's multiplying, and they would have some of the common signs and symptoms, a positive skin test, and abnormal chest x-ray.
So what are its long-term effects? Like you said it was a fever for a few weeks, but I guess to put it simply, why is it a problem?
So I guess depending on when you ask why is it a problem, do you mean particularly within the Filipino community? Well,
let's just go broad first. So what does it do to you in the long term?
Okay, well, the good thing about TB is that it is treatable, curable, and preventable. So you can take TB medications for those who may have TB infection, or what I also call sleeping TB. They may take TB medications for approximately 9 months to prevent that bacteria from waking up in your body. For those who may get sick with TB disease, they would have to take antibiotics for a minimum of 6 months or longer, sort of depending on a number of factors, including how sick they are, et cetera. So in Canada, for example, it's very rare that someone would die of tuberculosis. But there are parts in the world where people, according to for example, the WHO, World Health Organization, has estimated that approximately 1.5 million people died in 2013 of tuberculosis. But it's very rare in Canada that someone does, and that's because we have good access to treatment and diagnostics.
And so how is it transmitted? You said there, of the two types.
With an individual, physical contact, but it's really only spread through the air when someone coughs or sneezes. And even though it is an infectious disease, you really need to be around an individual for a long period of time. So if I was sick with TB, for example, who do you think would be at most risk of getting TB from me? A question back to you.
Yeah, I would guess your immediate family, no? Or friends or coworkers, that sort of thing.
Exactly. So people who, I spend a lot of time with. So my family, my friends, and, if I'm out in the community and I had TB and I'm giving a presentation for about an hour or so, the risk is very minimal. And in fact, for example, it's much easier to contract, for example, the flu virus than it is tuberculosis.
And so you mentioned that it is curable. So why, another very basic question, why is it still around? Why has it not been eradicated?
Okay, so that's a good question. In fact, actually, in Canada, like I had mentioned, we don't see high rates of TB in comparison to many other countries in the world, such as the Philippines. So in many developing countries, there is limited access to treatment and diagnostics. And this can affect, the transmission of TB and make it spread. And it's, as I mentioned, it's very rare that someone dies in Canada of TB, but unfortunately, and that's, again, because of good access to healthcare and treatment, but unfortunately, in many other parts of the world, this isn't the case. I think another important factor that plays in the role in the eradication of TB is the social determinants of health, and addressing those. And also the HIV epidemic. I mean, although TB is less common in Canada, it is a leading cause of death among people who are HIV positive worldwide. So people with HIV are at a much higher risk of becoming sick with TB.
So you've talked a little bit about Canada now, so let's bring it to the Philippines. I mentioned to you on the phone in our pre-interview that, when I did my field work in Zamboanga province last year, a lot of the people that were sick attributed it to TB, but none of them had, or most of them had not gotten professional diagnoses for this. So how rampant is TB in the Philippines?
Well, in the Philippines, it is a sixth leading cause of death in the Philippines, and approximately 75 Filipinos die every day of TB. And I think it's something, from what my experience so far, working sort of closely with the Filipino community. And sorry, I should mention that the Philippines is considered one of the top high burden countries of TB according to the World Health Organization. But what I did notice, or what I had observed, working with the Filipino community in Toronto, and also through personal visits to the Philippines, visiting family, is that there's a lot of, I felt, stigma related to TB, and no one really likes to talk about it. Or the other sort of perspective I found was that I guess it's so common that people are just, they're kind of like, oh yeah, they have TB. Not a big deal. And going back, I guess, to your experience in Zamboanga, is that with people, saying they have TB but not having confirmed diagnosis, again, I think that relates to limited access to, let's say, treatment and diagnosis. I mean, in Toronto, we have, some clients who have issues getting to their appointments. So I can only imagine in the Philippines, and as a result of, let's say, poverty, or they don't have, money to take the TTC. So I can imagine in the Philippines it's sort of the same.
Much worse, I would say.
And maybe much worse. And I'm sure, for those who live maybe in more rural areas in the Philippines, they may not have that easy access to, even getting a chest X-ray done. So I think that contributes to high rates of TB in the Philippines.
And I think, the medical costs alone, because unlike here in Canada with the healthcare system, everything would have to be paid for, right? So even if they did have access to a doctor, there's the financial burden on top of that. So maybe we can bring that to immigrants here in Canada. Do you think maybe this mentality has transferred here to Canada because of the fact that in the Philippines, you very rarely go to the doctor for various reasons, including, of course, monetary. Do you see a sort of hesitancy with Filipino migrants to visit the doctor here for issues like TB?
Well, I think my personal experience when I did, or I guess when I do outreach and education within the Filipino community, and when I've had Filipino patients, specifically, individuals who are still waiting permanent residency status, for example, they are a bit hesitant to, seek medical treatment. And I think that relates to fear of having TB and how it relates to their immigration status. For example, I've had patients who've been afraid, we've told them that their diagnosis, they have tuberculosis, but they're fearful that can negatively impact their immigration status and that they could be deported. So, and also, I mean, in terms of TB, low income and poverty new immigrants, I mean, some, like what we've seen in Toronto, for example, some new immigrant families in Toronto struggle to access health services because of poverty and all the ramifications of poverty. For example, it could be difficult to seek care when you're sick because of the costs associated, with the TTC or getting time off work. Or barriers exist. I don't find this an issue really in the Filipino community, but if you don't speak English, for example. And we also see new immigrant individuals and families experience overcrowding and sometimes, very precarious housing in Toronto. So crowding is definitely an issue as well, or crowding living conditions.
So since you're talking about Filipinos here in Toronto and in Canada, maybe, do you have any idea how big an issue this is for Filipinos in Toronto and in Canada? And is it more, I think you've hinted on it, is it more of an issue for migrant workers than with the ones that are already citizens?
Well, I think, TB within the Filipino community, I do believe that it is a big issue in Canada, more than we are aware of. And I think as long as we keep seeing immigration from the Philippines, we will keep potentially seeing TB among Filipinos residing in Canada. For example, like in Toronto, the top 3 countries in which most of our patients were born in are from the Philippines, India, and China. And so, TB sort of strongly, TB in Canada strongly coincides with sort of the immigration patterns that take place in Canada as well. And not only, does it, I think it's important for immigrants, I guess, who come to Canada from the Philippines, but also those who go back home and, visit their families or their loved ones for extended periods of time, because they may be exposed while traveling to the Philippines and may end up having TB when they return back home to Canada.
So you mentioned the migration issues. So are you saying that the concurrence of migration, the volume of people that are traveling around, this is actually leading to more cases of TB here in Canada? So are you basically saying that TB is coming from outside of Canada and coming here? Or is are they catching TB here? Or is it both?
Okay. No, that's a great question. So, I mean, Canada is not considered a TB or a high burden TB country. We get about 1,600 cases of TB in Canada every year. Now in Toronto, because I can sort of speak from a Toronto perspective, we get about 300 cases a year of TB, which approximately 95% of those cases are foreign-born. So most of our patients who have TB, it's most likely that they had been exposed to the bacteria from their origin or from where they're from. And sort of what happens is that they come to Canada. So part of that, every immigrant has to go through a medical exam, correct? And which requires a chest X-ray. And I'm often asked this question by a lot of, when I'm doing out presentations out in the community, they'll say, well, I did a medical exam which required me to have a chest X-ray to rule out tuberculosis. And what happens is that many of these individuals may have had TB infection. So the first sort of type of TB that I was speaking to earlier. And, with the process of immigration, it can be stressful, right? I mean, I haven't experienced it personally, but I think of my parents or the clients that I work with, and I can only imagine, how stressful that could be, learning a new way of life, a new language, trying to find a job, etc. And so what happens is that your immune system can break down, causing that bacteria to wake up, and now you have TB disease in Canada or in Toronto.
So let's you mentioned this already, but let's talk about it now. The social determinants of health. What did you mean by the social determinants of health? And, what do healthcare advocates think these are here in Canada? Okay.
Well, the social determinants of health, I think there is a strong relationship between the determinants of health and tuberculosis. And so basically, the determinants of health are the social and economic factors that can impact the health of individuals or communities. And this can be things such as living conditions or income and education levels. There's quite a number of social determinants of the health, but I think I can focus on a few that I think really pertain to TB, if that's okay.
Yeah. And if you can talk about it in relation to the Filipino community here, that'd be great.
Sure. Okay, sure, no problem. So, for example, income and social status. I think it's obvious that individuals with higher income and social status tend to have better health. And so when there are greater differences between the rich and the poor, there are also greater differences in health between the two groups. Another determinant of health is education. It's been shown that individuals with lower education levels, they tend to have poorer health, lower self-confidence, and increased stress levels. The physical environment, one's physical environment. In Canada, I think we're lucky. We don't really have to worry about, for example, access to safe water and clean air, or healthy workplace environments. But those factors can also negatively impact health. I think another important, a big social determinant of health, specifically for Filipino immigrants, is social support networks. And, those who have support from their families, friends, and communities, they tend to have better health, especially, if you're coming, let's say, for example, from the Philippines, and it's just really you and your partner and your children, and that's it. That could be really stressful, right? So I think social support plays a really big role, and also culture. We're lucky to live in one of the most diverse cities in the world, which I think is great. But I think, people who come from, let's say, the Philippines really value, Filipino culture, custom, traditions, and beliefs. And I think these all can also impact health as well. And then also, I think what's important for Filipino immigrants as well is personal behavior and coping skills. Again, the immigration process, can be stressful. Adjusting, for example, to winter.
That's a big one, yeah.
I don't know how people do it. Because I think it'd be very difficult for me to immigrate from such hot, beautiful weather to, minus 25.
When did you come here, by the way? Just as a side question.
Well, I was born here.
You were born here, okay.
Yeah. But my parents had immigrated here in the 1970s. And at that time, apparently, they had tons of snow. So, things that pertain to the immigration process, it could be very stressful. So, trying to live a healthy lifestyle, healthy eating, physical activity, and, using effective coping strategies to deal with, the everyday life stressors. So, one's personal behavior and coping skills can also play a significant role in one's health. And I think the last determinant of health that I'll speak to is, health services. I think in Canada we're very lucky to have good access, for the most part, good access and use of health services that, to prevent and treat TB, which I'm sure, this is different in the Philippines, where in some areas there really is poor access to treatment, to health care, etc. And, some Filipino immigrants may not be used to this access as well.
So I'm going to ask your advice now on how to overcome these determinants, because especially for the socioeconomic factors that you mentioned at the beginning, Filipino migrants to Canada, the newly arrived, tend to be on the bottom of that of the social class ladder, right? Here at York University, I did some work on one study which shows that even in the second generation, Filipinos are in general on the bottom of the socioeconomic ladder, and we're one of the few that actually make less money in the second generation than in the first, as a overall statistic. So, given all these socioeconomic determinants of health, how can we overcome this? And yet, what advice would you give to people who do come from these, more depressed socioeconomic backgrounds? How can they overcome these issues?
Sure. I don't know if I have the best answer for you.
I don't know if anyone has the best answer, but give your best.
To be quite honest. If I could get rid of poverty or low socioeconomic status altogether, I would. But I guess in terms of, TB, and I guess I'll speak to TB first. I think, one, being aware that you are at a higher risk of developing TB, know sort of the signs and symptoms of TB, or be aware, if you're having a cough for more than 3 weeks and it's not going away, fever, chills, night sweats, seek medical attention. For those who may be, for example, even, fearful of how TB can affect your immigration status, or maybe in the 3-month waiting period to get OHIP. Right? Don't be afraid to seek assistance, because TB is covered even though you may not have OHIP yet. So we've had people who've been sick with TB disease who didn't have OHIP. But, the provincial government has a program where we are able to fund for things such as getting chest x-rays, etc. And also, I think it's important, for new immigrants is that there are a lot of support out there to assist them with, finding employment, etc. Like the other day, I did a presentation among Filipino living caregivers, and I was speaking with the coordinators that sort of organize the session for me, and they were telling me what else they do, and teaching them computer skills, or helping them with resume writing, etc. So I think I think it's important to know that there are resources out there. It's just a matter of sort of tapping into them and utilizing them to the best of your ability.
I think that's
I think that's my best answer for you.
Oh no, that's great. That's great. Maybe we can go step by step there in the sense that, okay, imagine a listener right now saying, "Oh, okay, I didn't know this was free. I should get tested. I should check what's happening." What is this? What are the steps? What should they do next? How do they access this?
In terms of screening for TB, or
sure, just
or
imagine that.
Healthcare in general.
Maybe you can combine the two. Just
okay.
Imagine the listener who's thinking, "Oh, I don't want to get tested because it might affect my immigration." Oh, wait, I can still do this. It won't affect my immigration. What do I do next?
So what they could do, I mean, again, if they have any signs and symptoms, they can go to, if they don't have many people still don't have family doctors, for example, right? But I know there are clinics that provide free services for those who don't have health insurance across the city of Toronto. I can't give you particular names, but if you give my contact info later, I can provide that to anyone who's interested.
Okay. Maybe you can give it now, just so we give the correct contact information. How can people contact you?
Sure. So they can contact me by phoning me at 416-392-7409, and that's my direct line. Or you can contact me by email, gcaniza@toronto.ca. But going back to your question, is that there are various clinics across the city that do provide free health care services to individuals who may not have health insurance. And also there are, plenty of walk-in clinics across the city as well if someone doesn't have a family doctor. You can also go on, I believe it's the Ministry of Health and Long-Term Care, the website, where there's a link to find a family doctor that's accepting new patients. So, I mean, there's different ways of accessing health care. There's also community health centers across the city, or family health teams within different hospitals. For example, Toronto Western, I know they have a family health team there. So we're very lucky to have sort of different options and access to health care.
No, that's great. Okay, so let's go to, we're coming to the end of the show. So maybe you can just give some advice to some of to both individuals and to Filipino organizations out there that are working with community members. How can we do better to raise more awareness about this issue and make a final pitch as to why it is an important issue?
Okay, sure. Well, I think it's an important issue because there is a lot of stigma that exists among the Filipino community, and I think there's a variety of reasons of this. And when I was reviewing cultural beliefs about TB among the Filipino community, I found that stigma. There's a lot of misperceptions about what TB is and how it's transmitted or what causes it. A lot of Filipinos tend to believe that you could get TB from sharing the same cutlery or talking to a person with TB, and that they believe that the disease is dirty and it's dangerous. And what was interesting to me is I read that, some people among the Filipino community have fears about TB and how it can affect their marriage. So they would get divorced, or it reduces their chance at marriage. So that was really interesting to me. But I think knowledge, in terms of reducing stigma among the Filipino community, I think knowledge is power. I think it's important for us to continue to engage, in educational and outreach communities, not only among the Filipino community and immigrant communities, but also the general public, healthcare providers, etc. I also think there needs to be a lot of collaboration among stakeholders, among Filipino organizations to help raise awareness about the impact of the social determinants of health and how that affects Filipinos' health. Filipino people's health. And actually, while working in the Filipino community, I found that there really isn't, for example, a health fair of different organizations among the Filipino community that takes place. And I think that would be a great way to really raise awareness about TB and other health issues. So I've been in touch with a few people, so we're hoping to perhaps do that in the near future.
Or even to combine with some of the larger Philippine gatherings in the summer, right? That'd be fantastic.
Yeah, I think that'd be a good strategy. So we'll see.
So thank you very much. I guess one final thing I'd like to say about this is I think we should remind everyone that it is free, the services here, to be able to check up on this. And it is, like you said, there is a cure, right? So it's easily curable. So I think that's a big way to overcome the stigma is you can get rid of it, and it's you can do it for free. So
so all TB medications are free, whether you want to take it for preventative measures or if you are being treated for TB disease. It is all free. So that is an important point to end off with.
So fantastic! Thank you very much. That was Genevieve.
Okay, thanks for having me.
Hopefully we can have you back.
All right.
Until next time.
Take care. Bye.
Bye-bye. So that was Genevieve Canizares. She's a public health nurse currently working in the Tuberculosis Prevention and Control Program at Toronto Public Health. So if you wanted to get in touch with her for more information or to find out where you can find out more information, please give her a call at 416-392-7409. Again, 392-7409. Or email her at gcaniza@toronto.ca. So World TB Day is held yearly on March 24th to create awareness about the global public health issue of tuberculosis. TB is a serious illness, but it is preventable, treatable, and curable. Although TB is curable, over 1 million people worldwide still die from it each year. In 2013, there were 287 cases of TB here in Toronto. And over 90% of these cases were among persons born in or traveled to countries where TB is more common. Many people born in countries such as China, India, the Philippines, and others received the TB BCG vaccine when they were young. However, this vaccine does not give good protection for adults. In fact, 1 in 3 adults worldwide have inactive TB infections and will have a positive tuberculosis skin test. The challenge is how to stop the worldwide spread of TB. Data provides that mostly affected by this deadly disease belong to low-income families who cannot afford the cost of drugs and the nursing costs. Most in the third world, including the Philippines, experience prevalence of TB, particularly in the provinces due to the inequities in access to healthcare. Governments must must implement to remove barriers to healthcare and resist the increasing involvement of for-profit companies in the organization and delivery of healthcare. Health policymakers must direct attention to existing inequities in accessing healthcare and to identify and remove barriers to healthcare. And as they say, prevention is better than the cure, but community leaders and health and group advocates should do more to come together and demand the rights to proper health care, affordable drugs, and medicine costs, especially in the Philippines. So up next, we're going to play a recorded interview for our Pulso Migrante segment, and we'll be back in about 5 minutes to wrap up the show. But stay tuned for this segment of Pulso ng Migrante.
2 linggo mo lang ngayon, tinatayang 45,000 mga temporary foreign workers na mga Pilipino ang pauwian ng gobyerno ng Canada sa Pilipinas. Resulta ito ng 4-in-4 rule na bagong patakaran ng Canada para sa mga TFWs na ipatutupad sa darating na Abril 1. Ang 4-in-4 rule ay nagsasaad na kinakailangang pauwiin ng sinumang temporary foreign workers o TFWs na nakatapos na ng kontrata sa loob ng 4 na taon. Hinihingi ng mga TFWs na bigyan sila ng pagkakataong magkaroon ng permanent status sa halip na deportasyon. Tinanong natin ng mga kababayan natin dito sa Kalakang, Toronto kung ano ang kanilang reaksyon hinggil dito.
Gusto ko rin sana, I'm praying na sana magkaroon din yung iba ng mga papel para yun, maka-work din sila, lalo na yung mga kaibigan, di ba? Oh, it's so sad. Napakalungkot po. Imagine, nandito na sila, pauuwiin pa sila. Since napakahirap naman ang buhay in the Philippines. May marami akong kaibigan din na walang papel po. Yun lang.
Kung ako ang tatanungin, kailangan namin ng permanent status. Kaya nga kami nandito kasi first and foremost, kailangan namin mapabuti, pabigyan ng magandang buhay ang mga anak namin. So kung i-deport kami, ano mangyayari sa amin sa Pilipinas? Wala kami trabaho doon. Dito, bibigyan kami ng pagkakataon maging permanent residents. So makukuha namin pamilya namin, makakapagtrabaho kami dito, makakapagbigay kami ng tulong pinansyal sa mga pamilya sa Pilipinas, at the same time mapapaganda ang buhay ng aming pamilya.
A lot of Filipinos come here legally. We did our best kahit pinagbenta na natin kalupa-lupaan para lang maging legal dito. And ayaw natin, I love our brothers and sisters na mga Pilipino na magstay dito. Kasi tayo mga Pilipino napaka-workaholic, ang dali natin matuto. We cope very well sa sitwasyon, lalo na sa mga ibinibigay sa ating mga trabaho or something. We're so workaholic talaga.
Pero siguro dapat yan ang gobyerno naman natin ay magkaroon naman ng puso. Dahil mga tao naman pumunta dito para maging maayos ang kanilang pamumuhay, di ba? Bakit sila bigyan ng chance na i-prove sa gobyerno na karapat-dapat na mag-stay sila dito? Dapat lang din. At pero siguro yung pangunahing dapat gawin ng mga migrante dito ay mag-organisa sila among themselves, at siguro ay maging aktibo sila sa mga organisasyon na tumutulong at lumalakad para maging maayos ang kanilang kalagayan dito. At siguro at isa pa doon ay maisulong din sa mga bawat kumpanya na magkaroon ng union para maprotektahan sila bilang mga manggagawa at migrante dito sa Canada.
Kailangan sila bigyan ng permanent status. Especially, hindi naman ako pero tayo mga Filipino, known tayo sa pagiging hard worker, dedicated, respectful, at saka close ang culture. Dapat lang siguro na bigyan sila ng chance. And kung meron man mga advocacy tungkol doon, kung meron man mga activities na pwede nating tulungan sa mga ito, I'll make sure na kasama ako sa kanila.
I think this is injustice. No? Bakit? Anong karapatan nilang pauwiin? Because sila ang gobyerno, pwede nilang gawin ang gusto nilang gawin. Hindi man nila nalalaman anong hirap ang dinanas ng mga temporary foreign workers natin para sila'y magtrabaho dito sa napaka-frigid zone ng Canada, you know. This is really injustice for these temporary foreign workers.
Kaya dapat i-retain nila dahil pauwi sa Pilipinas, anong gagawin doon? Siyempre, nakakalungkot dahil nandito na sila tapos i-deport.
Sabi nila magangang buhay, magandang opportunity. Pero kung di naman ako bibigyan din ng papeles dito, hindi nila bibigyan ako ng pagkakataon maging immigrant or kailangan namin is permanent, hindi deportation. Bigyan nyo kami ng pagkakataon. Maipakita namin sa Canada kung gaano rin kami mga Pilipina na Pinoy na makakabibigay ng pag-asa dito sa Canada. Maganda kami magtrabaho, maganda ang pagiging relationship namin sa tao dito. So, bigyan kami ng pagkakataon maging immigrant.
Siguro naman, it's better na i-review nila mabuti kung talaga, di ba?
At saka yun nga lang ang sa akin, basta kung pwede, ipakiusap sa gobyerno na i-review ang sa kanilang mga status. Yun lang ang siguro para sa akin, it's the best. Kasi siyempre may reason sila, may reason tayo. Kailangan maging tayo, di ba? Unfair. Samantalang nangangailangan nga sila ng mga skilled workers. Of course, di ba? Paglaban mo. Ipaglaban natin ang permanent status natin.
Walang kasiguruhan ng buhay na babalikan ng mga kababayan nating apektado ng malawakang deportasyon. Ngunit isa lamang ang tiyak, walang malinaw na plano at programa ang gobyerno ng Pilipinas sa mga i-deport na mga TFWs. Kaya ang panawagan nila ay mabuti pang magbitiw na si Bias Aquino sa pwesto o harapin ang galit ng sambayanan para sa kanyang pagpatalsik. Ito po si Queano para sa Pulso ng Migrante.
So thank you to the Radyo Migrante Collective for putting that Pulso ng Migrante segment together. We're at the end of our show today, so please stay tuned. Roy Green of Odyssey is up next. And if any of our listeners locally here in Toronto, or even not locally, are interested in getting involved with the Radyo Migrante Collective, please give us send us an email or give us a call. Our email is RADMIG 105.5 FM at gmail.com, or call us at 647-281-0652 if you're interested in taking part. So you can either get training to be on the board, you can come into the studio, or even wherever you are in Canada or around the world, if you want to put together short segments of what's happening to the Filipino community where you are. That'd be great. We'd love to share those little tidbits from wherever you are in the world listening to the show. So thanks again. Up next is Odyssey with Roy Green, and we'll be off with the song by Joey Ayala. Have a good night, everyone. See you next week.
Tabi po, tabi po!
Naglakad ako sa daang putikan, sa sobrang dulas ay napilitang magyapak. Hinubad ko ang bagong sapatos ko, tinali sa aking backpack. Gumapang paakyat sa putik at bato, at nakarating sa balikat ng bundok. Naglakad paloob sa makapal na kahuyan, nakarating sa daang madamo ng sapatos ko. Isusuot na sana, kanan na lamang ang natitira. Kung saan naman nakarating ang kaliwat, binalik-balik ay di pa rin makita. Ano ngayon ang gagawin ko? Iisa na lamang ang sapatos ko. Ito na ba yung sinasabi nilang pinaglaruan? Tabi po, palabiro, mapaglarong engkanto. Tabi po, palabiro.